Hello everyone, welcome back to the channel. Eyes are arguably the most important of the five senses that we have. We perceive this beautiful world around us predominantly through our eyes. But for that, both the eyes need to look at the same object. When the two eyes start looking at two different things, that causes a lot of confusion in the brain. That condition is called as squint or strabismus. This is a very common condition in pediatric population. Today, to discuss about this, we have expert with us, Dr. Swathi Mailankody, who is a pediatric ophthalmologist. Welcome, Dr. Swathi, to the channel.
Thank you, Dr. Skanda. So, a lot of studies in India have shown that nearly 10 out of 1,000 children are suffering from some visual impairment, and many of them may even be blind. And one of the common preventable cause for this visual impairment is, like you said, squinting of eyes.
Okay, so let's start with the basics. What exactly is squint and what are the causes of squint?
Yeah. So squint, or in medical terminology what we call as strabismus, is simply misalignment of eyes. The two eyes that we have are normally aligned in the same direction. Both are looking at the same object. Due to any reason, if one of the eye gets misaligned, that is, when one eye is looking straight, the other eye is either looking inward or outward or up or down. So in such a case, we say that such a patient is having squinting of eyes.
This, I think, is more common in pediatric population, and a very important thing that I want to ask is, does it get automatically corrected with age? Like I have heard a few parents saying that the kid initially had squint, but as the kid grew older, the squint just disappeared. Is it true or false? And it's very important, because if it's not true, then this kind of statement will really discourage a lot of parents from seeking medical help in the initial days.
Yes, I agree. We see a lot of kids who come at an older age, and when we ask them why they haven't been shown earlier, it's a very common statement that we hear from the parents, that our neighbor said or a relative said that their child had the same issue and which got corrected as the child grew older. Unfortunately, this is not true. It's a myth. So most squints never get corrected without any treatment. There is an entity called a pseudo squint or a pseudo strabismus, where due to some facial features like the shape of the nose or shape of the face, the child appears like he has a squint, but the alignment of the eyes is parallel. Both the eyes, when you examine, you'll see that they are looking at the same object.
Just the external
appearance. It's just an external appearance due to the shape of the nose, etc., which gives an appearance as if the child may be having squint. So this, as the child grows older and the bones of the face develop, the squint appears to have disappeared. So that is probably the only reason why you would
some
say
parents
that,
end up saying that it disappeared.
And this squint or pseudo squint can only be identified by a trained specialist. It cannot be a parent or a layman cannot say whether what the child is having is a true squint or a false squint. So even with the slightest doubt, if the child, the parent of the child has the slightest doubt that the kid may be having some alignment issues of the eyes, it is always best to get it evaluated and confirm. If the doctor says it is a false squint, very good. If it is a true squint, also very good, so that you can start treating it at the right time.
So why do children have squint? As in, what are the causes why kids end up having this squint?
Yeah. So some of the squints are hereditary. We call it as congenital squints. Kids may be born with the squint. Other than that, we can also have something called as uncorrected refractive error, where the child requires spectacles or glasses to see clearly, but it's not been picked up and the child is not using. Yeah. So due to the blurring of vision, the child has to tries to accommodate for it, and the muscles of the eye are overactive now, and this can also lead to squint. So uncorrected refractive error is a common cause for squint. Apart from that, any neurological issues that the child may have, or developmental issues, or sometimes an absolutely normal child with no other issues can also have squint without any other underlying cause as such. Adults also rarely present squint, like though they did not have it in the childhood, they may develop squint later in the life if they have any history of any injury to the eye or head injury, any neurological problems, diabetes,
So
thyroid.
by neurological problem, you mean basically the muscles which are
Yes,
controlling the eyeball movement
Yes,
get
the
affected.
muscles which are responsible for eyeball movement are in turn supplied by some nerves which come from the brain. So any problem in these nerve or any neurological issues can affect the eye movements as well.
Okay. So can it be cured? Like what are the treatment options we have today to correct the squint?
Yes, definitely it can be cured. A lot of it's another myth that squint cannot be cured. So a lot of parents assume that anyway it cannot be cured, so no need to
They don't kind of
approach
coming to a
doctor. But that's not true. Squint can very well definitely be cured. Like I said, one of the common causes for squint is an uncorrected refractive error. So you just treat that. You give glasses, and a lot of squints do get, some may even get cured completely, or at least they improve to a large extent with just use of spectacles. Other than that, we have some eye exercises to strengthen the eye muscles. And the third option and the most definitive option would be a surgery. A surgical correction to change the alignment of the eye such that the squinting eye is now aligned with the other eye.
You mentioned about squint surgery. See, usually what I noticed is our patients are very hesitant when it comes to surgery. They usually prefer medicines or other non-surgical forms of treatment. That is what I feel as a surgeon is predominantly because of two things. One is the concerns about the safety of the surgery. Second thing is the cost factor. So can you elaborate a bit about the safety of squint surgery and the cost of squint surgery in different hospital settings of India?
So yeah, squint surgery is an extraocular surgery. By this I mean the surgery is being done outside the eyeball. Like we discussed, there are a few muscles which are responsible for the eye movement and eye position around the eyeball. So we are not entering into the eye. It's a surgery which is done outside the eye. Therefore, it is not going to affect the sight or the eyesight or the vision of the child. Squint surgery is an extremely safe surgery with very minor complications like bleeding or infection,
Which is
irritation
common to any kind of surgery.
of
as
any
such.
surgery. Yes.
Yes, yes. And what about the cost? Like how expensive is that? Can a middle class family afford to have a squint surgery for their child?
Yes, definitely it's not very expensive. The cost would depend upon a few factors. One of them is the age of the patient. Since predominantly squint is seen in pediatric population, any surgery being done on the pediatric population would require a general anesthesia. So that would add to the cost a little bit. Also the type of squint. Few squints are very simple where just one or two muscles we need to operate. So the time for the surgery and the time for surgery is less. So whereas of complicated surgeries would require us to handle more muscles, maybe operate on both the eyes. So this would add to the cost. So anyway, in a private setting, depending upon these two factors, the cost would be anywhere between 20 to 45,000.
Okay.
And I think a lot of government hospitals with in the major cities have a pediatric ophthalmologist in the hospital,
It
and
will be
would
almost
offer
near to free.
would offer this surgery for very minimal charges or even free probably.
So if it's 20 to 40, that means even in the metros it might go slightly a bit higher
Yes,
than that.
yes.
That's all. So as such, there is no reason why somebody shouldn't have their kids treated for squint, because even the cost factor, safety factor, cost factor, all these things are in favor. But in case, in spite of all these things, if somebody do not get their kids treated, that is, if the squint goes uncorrected, what happens? What are the problems of not correcting the squint?
Yeah. The other misconception that people have is that squint is just a cosmetic problem, so it's okay to leave it just like that. This is also not true. Squint can, especially squint which occurs in children, can cause visual impairment or vision problems also. So like I said, when our eyes are aligned, both the eyes are looking at a single object, and this image is captured by the eyes and it reaches the brain. So in simple terms, our eyes are like cameras. So imagine that two cameras are placed such that they are both capturing the same image. Now due to squint, if one of the eye or the camera here, one of the cameras is misaligned, and one camera is capturing the image which is right in front, and the other camera is capturing another image on the other side, the brain receives two images and the brain gets confused whether to look at this or to look at the other image. So when this happens at a very young age, where the eye is not yet developed completely, the brain is immature, so in such a stage, the brain shuts off one of the cameras. It stops seeing from one of the eyes.
Okay.
It uses only one eye to see.
To get rid of the confusion.
To get rid of the confusion, yes. So when this continues, or when this happens for many months together, the eye which is not being used at all gradually becomes weak, and there may be permanent visual loss even in that eye. This is what we call as lazy eye in simple terms, where one of the eyes, without being used, it has lost its potential to see well.
Okay.
So if
because the brain has been suppressing it for a very long time.
Yes, brain is preferring only one eye and suppressing the other eye. So any child with squint, if not treated at an early age or a young age, may lose vision in one of the eyes, and forever, permanently, the child may have to use only one eye for all its activities. So definitely squint is not just a cosmetic thing. It can affect the vision, and vision problems in squint is a very common thing. Secondly, human beings have this special gift of what we call as 3D vision or depth perception. It's a very unique feature that human beings have.
Unlike birds.
Exactly.
Yes.
Unlike other living beings. So this 3D vision is because our both eyes are aligned and working together and looking at the same object simultaneously. So again, when a child develops squint and is using only one eye at a time, the child is not going to have 3D vision. So the quality of vision is also different that the squint patients have and normal children will have. So due to these reasons, it is even more important that we get it
treated at an early age, before the brain starts suppressing one of the eye.
And not consider it to be a cosmetic problem, which can be taken care of later also.
So you mentioned this fancy term called lazy eye. So tell us more about it. How do you treat it? If the child comes to you he has already developed lazy eye, so can it be reversed back? Is it possible to treat it?
Yes, till a certain age, it is still possible to reverse it. Roughly we say it's not a strict cutoff, but around 7 to 8 years when the maximum maturation of the eye and the brain is complete. So if we intervene before that, it is still possible to reverse this lazy eye. The commonest and the simplest method of treating that we advise is eye patching, where we advise the children to keep the normal eye, the eye which is preferred or the eye which is seeing better. We ask them to cover that eye using an eye patch, and for few hours a day, we insist on them using the lazy eye or the weaker eye more. So basically what we are trying is to reprogram the brain and remind the brain that yes,
the other eye exists.
The other eye also exists, and when the better eye or the preferred eye is closed, the brain slowly starts remembering the other eye and starts using it. It's not a overnight process or an immediate process. It is likely to take a few months to even a year, depending upon how bad the condition was to start with. So definitely prevention is definitely always better than cure, because eye patch itself is it's a simple thing to do.
I think the biggest problem will be compliance, considering that they are kids.
Definitely.
So they will obviously want to prefer the eye which gives them a better vision.
Yes, involuntarily or unconsciously they try to remove the patch because it's very disturbing for them to try and see with the eye with lesser vision. So
it's I think more important that the parents are aware the exact reason why it is done, so that at least they monitor it. They make sure that the kids
cannot expect the child to understand the implications of this. They for them they don't know the seriousness or what are the future implications of this. So definitely you can't expect them to sit with a patch for hours and do the work. It's a little burden on the parents to ensure compliance. So wherever possible, it's always best to be prevented
Yes.
and not reach the stage of lazy eye and then try to correct.
try to correct.
But in case for whatever reason it has not been handled earlier, yes, in the early stages, there are studies which have shown now that even in adults we can still try for these therapies for amblyopia, but the results are best in done in childhood.
Preferably less than 7 to 8 years.
Yes, before 7 to 8.
So you said one of the causes of squint is refractory error. So refractory error is obviously corrected with glasses.
Yes.
So if a child is prescribed glasses for refractory error, is it permanent, or after certain age the child can get rid of the glasses?
So there are different kinds of refractive errors. Commonly what we call a short-sightedness, far-sightedness, or astigmatism. Any of these can cause squint. So it depends on what is the refractive error, how much is the power to start with. Not all refractive errors would go away with time. So some of them would require the child to wear glasses lifelong. Some refractive errors where the power is mild to start with, or the child has far-sightedness, they do tend to reduce with time, and as the child grows or reaches the adulthood, there is a possibility that they may not require glasses, but it varies from case to case.
Obviously we cannot generalize, make
We
a
cannot
general
generalize,
statement that
yes.
it can be. Okay. We usually have a tendency to blame everything on the food as well as try to correct everything with the food intake. That's what even I have noticed in my practice. So is there any role of the food intake, or can this be corrected with the diet modifications?
No diet can change your glass prescription or change your squint.
I'm sure this is a very common question
Yes.
to you also. Yeah.
Diet does have a role in the overall health of our eye, like any other organ of our body. There is a myth that eating carrots every day would cure all problems of your eye. It is not true. Carrots are healthy. Carrots and any other fruits and vegetables which are yellow or orange in color are rich in vitamin A, which is an essential nutrient for the eye. Other than that, foods like green leafy vegetables, nuts, fish, etc. have some micronutrients which are helpful to maintain the nutrition of retina, which is the inner nerve layer of our eye, and also to prevent dryness of the eye, etc. So I would say these food items are good for our eye, for the overall general health, but there is no specific condition, or especially it is not going to change your spectacle power. Your number of the glasses is never going to reduce by any exercise or any food that you can take or consume on a daily basis.
Another commonly heard thing is that parents often tell their kids not to watch TV from a close distance, or for that matter don't look at the mobile for a long time. So basically this screen time, does it really have any role in the child getting the glasses at a later date, or immediately as well?
Yes. In the last couple of decades, we have seen that the eye problems in children have definitely increased compared to earlier. One could be, of course, the better screening facilities available now. All schools have screening programs.
So it's picked up.
It's picked up more often. And also, definitely, it is probably related to, studies have shown that it is probably related to the excessive screen time as well. What you have seen that is kids who do excessive near work, where they are constantly focusing at the same point all the time, like watching a mobile or using a tab or iPad, they do tend to have a worsening of the myopia, refractive error, more commonly than other kids. So definitely limiting screen time would definitely be helpful in controlling or avoiding a lot of eye problems in children.
Okay, it's been quite an informative session on squint and refractive errors. So tell me, in general, should the parents take their kids to an ophthalmologist even if the kid doesn't have any problem as a routine checkup, or they should consult the doctor only if the child shows some symptoms?
Yeah. Like I said, the incidence of eye problems in children is quite significant in the past few years. So it would be ideal to get at least a baseline evaluation done once before the child starts school. So the recommendation would be somewhere around 3 or 4 years. Just get even if you feel the child is fine and not having any issues, it is best to get eyes checked. The reason being, one, mild errors may not be picked up at home. Secondly, some kids may have problem only in one eye. They may have a refractive error only in one of the eyes. So they may be doing all their activities normally because one of the eyes is seeing well. This is also another cause for lazy eye because child ends up using only one eye. So such kids usually end up being missed for a very, very long time, and only once in the school, when any regular checkup or due to any other issues, they'll end up in the doctor's clinic for some infection or any other issues, and when incidentally they are found to have problem in one eye, and if they are still younger than 7 or 8 years, we can still revert that lazy eye problem. But if it is delayed, they may remain permanently with the lower vision in one of the eyes. So this is why it is important or ideal to get a basic routine checkup done before starting school. Additionally, small kids especially, are unable to voice their problems. They are unable to say that they may be having any eye problems or vision problems, whether they are seeing clearly or not. So there are some indirect signs which the parents have to pick up, like the child going close to the TV and watching, or unable to copy from the board in the school, making mistakes, or frequently keeps rubbing the eyes, or there has watering of eyes. So these are all some indications that the child may be having some vision problems as well. So in those cases also, don't wait for the child to say that I cannot see. Any eye related symptoms can be due to vision problems as well. So in such cases also, it is better to get the eyes checked.
If it's not a big problem, then well and good. But if it's a problem, at least it gets picked up easily. Picked up early. Yeah.
Also, if either of the parents have any eye issues, or the child is born prematurely, or child has any other developmental issues or neurological issues, in such cases I would suggest them to show an eye doctor at an earlier age, say even 1 or 2 years of age. It is better to come and consult a specialist, because these are the kids who are slightly more prone to have vision problems, squint problems, compared to the other kids.
I'm sure a lot of doubts that a lot of you had got cleared with the expert advice of Dr. Swathi. It's really been a very, very informative session for me as well. Thank you so much for coming to the channel. Thank you so much.
Thank you for having me on the channel. Thank you, Dr. Skandar.